Today I'm going to discuss technology's role in the healthcare space and how it is enabling healthcare systems all over the world to step into the future of democratized, accessible, and affordable healthcare. Delivering high-quality healthcare to patients is becoming increasingly expensive. Healthcare systems all over the world are increasing the amount of money they spend on keeping patients healthy. This is due to many reasons, some of which are increased patient access, increasing healthcare utilization, and managing aging populations. The largest healthcare market in the world is North America, driven primarily by the United States, followed by Europe and Asia Pacific, with about a quarter of the global healthcare spend each. Looking over the last 10 years, we have witnessed the rapid growth of healthcare spend in the APAC region relative to the rest of the world. The map shown here indicates that as a region, APAC's healthcare expenditure has grown 80% over the last 10 years. If we zoom in on the Asia Pacific region, we can clearly see dominant growth driven by China and India, in which healthcare expenditure has grown over 200% in the last 10 years. One interesting trend that sets APAC apart from the rest of the world is if you compare mature market growth, such as Japan, South Korea, Australia, New Zealand, and compare them to the ASEAN markets. The ASEAN markets, while lagging behind the explosive growth of China and India, are growing their healthcare expenditure at a rapid rate. If we look at the demographic information across the APAC markets, we'll see that the mature markets are fairly similar in terms of rural population split, elderly population split, and internet connectivity rates. The same is true when you consider China and India as a similar region. The ASEAN markets, however, vary greatly from one another in terms of how rural their population is, how old their population is, and the rates of internet connectivity of their citizens. This diverse array of markets presents real challenges to expanding effective healthcare, while at the same time present very interesting opportunities for technology in the healthcare space to solve common healthcare issues seen in other markets around the world. Healthcare systems around the world have adapted differently to COVID-19, but one common thread exists in their adaptation, and that is centering healthcare delivery around the patient. This means leveraging systems and technologies that allow healthcare providers to provide care to patients where they are and when they're able to receive care as much as possible. Technologies such as telehealth and remote patient monitoring have allowed healthcare providers to leverage telecommunications technology to continue to keep patient engagement high while ensuring quality care for chronic conditions and other patient healthcare needs. Competitive solutions on the market make it easier for patients to find the providers they prefer, and this can be achieved through digital front door solutions to unify patient engagement through digital channels that patients are already familiar with, such as social media, web, and email. A2P messaging solutions can also be leveraged to increase patient outreach and manage patient treatment adherence in order to keep care quality high and easy to follow. There are many examples of technology that enable healthcare providers to put their patients at the center of care delivery. Some prominent examples in the telehealth space are MyDoc and Doctor Anywhere. These are virtual care platforms. These services allow patients to seek healthcare via virtual means and allow patients to access e-prescriptions, testing, and home monitoring kits for chronic condition management, as well as access physicians in order to diagnose or manage their healthcare needs. These solutions save patients unnecessary travel and can act as an inviting engagement point with patients who might ultimately avoid timely healthcare visits. Another example is Vivify Health, a remote patient monitoring platform that helps providers unify and manage their RPM program. Providers can custom tailor programs to their patients' needs and ensure adequate monitoring and timely interventions can occur. In the digital health space, players such as Noom, a digital weight loss and health management app, engage patients in order to assist them to lose weight or prevent and manage chronic conditions such as diabetes. This is a consumer-side approach, but apps like this help empower patients to live healthier lives. The technical revolution in healthcare is happening all over the world, accelerated through the pressures of COVID-19. As the cost behind delivering effective healthcare to patients continues to increase, providers are increasingly forced to look for ways to reduce costs while at the same time increase the care quality they deliver. Superior asset management means that providers can maximize the time operating rooms and their instrumentation, such as X-ray, ultrasound, and MRI scanners, are being used while minimizing their downtime. It also means that providers can increase the impact of their staff, ensuring nurses and physicians are seeing the patients that need them the most, and focusing on the most effective care options without wasting time re-diagnosing or re-imaging patients. Providers are also embracing intelligent automation technology, which automate complex administrative tasks in order to reduce the documentation burden on frontline staff, physicians, and patients, all to ensure consistent and compliant data ingestion. Effective healthcare providers are also leveraging technology to optimize how healthcare services are delivered to patients. Superior coordination through their healthcare journey ensures that redundant care is eliminated and that care is delivered and reimbursed in a timely manner. There's a growing number of technologies that enable healthcare providers to enhance their internal operations. CenTrack, for instance, is an asset tracking solution that enables providers to track their nurses' movements and detect who's closest to problems that need to be solved. For instance, if a patient finds themselves in need of help, the closest nurse or nurses can be instantly called to their aid instead of putting out a broader call and less efficient call to wider staff. Nuance Communications offers an ambient clinical intelligence platform that allows physicians to focus on treating patients while their conversation is parsed to automate documentation and administrative tasks. This allows the physician to truly focus on the patient, and they could deliver superior care because of this. Epic Systems, they offer a suite of data-driven operations, including EMR, revenue cycle management, and managed care. These solutions allow providers to put digital and data-driven decisions at the very core of how they deliver care to patients in order to reduce costs and optimize reimbursement. The true power of embracing digital tech in healthcare space is when you start to combine the capabilities of multiple solutions. A pertinent example of this are fully connected mobile vaccination clinics. During the global pandemic, reaching patients has been difficult for many countries. One solution to this, in the Philippines, for instance, are buses equipped with connectivity devices to allow healthcare workers to reach unvaccinated populations and provide vaccination services, while managing reporting and registration requirements directly from the field itself. Similar systems have been put into place in other countries, such as Canada, in order to rapidly vaccinate their population. Additional technologies that are being put into practice by healthcare providers to better allow them to reach patients are mobile communications such as A2P messaging, which allow providers to communicate with patients via text in order to provide them reminders about appointments, announce upcoming local health services, or even answer patient questions about seeking further care. These types of solutions allow providers to build better community trust, increase patient engagement, and provide superior patient experiences. Technology has the potential to put quality healthcare into the reach of every person on this planet. Healthcare providers will need to embrace different solutions based on their unique patient population needs in order to maximize their healthcare delivery. Providers and healthcare systems that seek to democratize healthcare will have to embrace solutions that allow them to, one, ensure patients have access to specialists. So whether this is through enhancing provider-to-provider communications or through advanced means like telerobotic surgery or through embracing medical tourism and regional resource sharing, effective healthcare requires that patients see the types of physicians they need to see. Number two, shifting care settings away from brick and mortar and into the home will ensure that even the most hesitant of patients will increase their engagement with healthcare services. Number three, you want to ensure that healthcare services are affordable. There are several paths to affordability, some of which include value-based care and population health management to prevent costly interventions, and there are also direct-to-consumer offerings to better tailor services to individual patient needs. And lastly, you want to empower informed patient decision-making by giving patients access and control over their own health data. You can then ensure that they're active drivers in pushing their own healthcare journeys. There are many solutions being developed today that enable providers to extend the reach of the care they offer to their patients. One example are connected ambulances. Telecom player BT has partnered with University Hospitals Birmingham to develop ambulances equipped with 5G tech to connect paramedics and doctors in real time. Augmented reality components allow the physician to direct paramedics in order to deliver specific interventions prior to even arriving at the hospital. Another example is the virtual second opinion service known as The Clinic, offered by Cleveland Clinic, which allows patients to seek alternative treatment plans or diagnose issues they're facing through virtual means. One last example is Epic Systems' patient data portal MyChart, which enables providers to connect patients with their own health data and make interactions between the patient and provider a lot more seamless. Technologies like these all have the capacity to enable healthcare providers to reach beyond their current brick-and-mortar institutes. The future of healthcare is connected and patient-centric. In simple terms, successful healthcare systems of the future will empower patients with their own health data to inform their decision-making and make them partners in their own health. It will also let doctors focus on providing care and let technology handle the rest. And finally, be where the patient is when they need you. Systems that fail to adopt these approaches will marginalize large portions of their patient pool, and this can lead to very costly and ineffective health interventions down the road. Ever heard of an apple a day keeps the doctor away? Well, a bit of smart technology adoption today will create healthcare systems that stay. Thank you for listening.